Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech. Really looking forward to this session with Magellan Health. Thank you, Boat. How about we start with some introductions? Perhaps Dr. Ball and then Dr. Carney, if you want to introduce yourselves, please.
Sure. I'm Elisa Ball. I'm a clinical psychologist by background, and I have the pleasure of leading strategy and innovation for Magellan Health.
Hey, Salome, thank you so much for having Magellan on Going Digital again this year. I am Caroline Carney. I'm president of Magellan Behavioral Health and chief medical officer of all of Magellan Health.
Thanks so much. And Dr. Carney, for our listeners who might be unfamiliar, what does Magellan Health do?
Magellan Health is actually a very broad company that has a footprint across pharmacy management services, specialty health management services like utilization management for high cost and complex services, managing federal services with direct to individuals who are serving in our military, and our behavioral health services, which we're here to talk about today. It is a broad company, as I said before, today with over 9,000 employees who I can tell share a great deal of passion for the work that we do and the members that we serve. If I focus down on our behavioral health business, we have clinicians from across the behavioral health spectrum, including therapists like LCSWs, physicians, child psychiatrists, nurses, adult psychiatrists, really the whole spectrum of experts to get us to the right kind of clinical care and the right kind of policy. We address all aspects of the member's journey, from outpatient services to the highest levels of complex care and the highest levels of treatment for complex care as well.
That is a lot. I think if I could ask both of you, perhaps Dr. Ball and then Dr. Carney, what have been some of your top priorities and initiatives lately?
We've been looking at anything that allows us to serve a full wide approach of problems, from anything from well-being to more complex initiatives. We're looking carefully at ways to get members engaged and reduce stigma along the way.
My top initiatives, in addition to what Dr. Ball shared for the company, are aligned with what we're seeing as needs for the country, particularly around using innovative methods to increase access and availability, more importantly, availability of care. And we're doing that through changing the way we interact with providers, through trying to align members with the right level of service that is needed for that member, and creating innovative clinical programs so that different kinds of supports are available to members, especially those who may be at risk for hospitalization or a terrible outcome like suicide. So we're all in on doing what is best to evolve with these changing needs we're seeing in our country today.
Now, these are phrases that I think we talk about quite a bit on this show, but if I could ask both of you, why do you think those initiatives are important in this moment in time?
So I think first, the idea of reducing stigma is so incredibly important because it keeps people from accessing the care that they need. So without the focus on reducing stigma, we fear that people who need care the most just simply won't access it. We've also been focusing a lot, and this is one of the partners we'll talk about, but on the work that we do with NeuroFlow. And why that is so important, because it enables us to take a look at what's happening between sessions. It has a number of really important measurement devices that, for example, can help detect whether someone's experiencing suicidal ideation. It's been really important for us this year because we put up some markers where we felt that should happen in a population, and indeed that's doubled and enabled us to really reach out to impact people and save lives at a time when we wouldn't be seeing it elsewhere.
I echo everything Dr. Ball said. And I think if we look at the pandemic, which many are sort of giving credit to, if you will, for the rise in mental illness, especially among adolescents. The truth is that that was on the rise before the pandemic, as were substance use and alcohol use disorders. The pandemic added fuel to that fire and created this perfect storm of what we're seeing today. One of the good things, to touch on Dr. Ball's point about stigma, is I think the pandemic did help reduce some of that stigma to allow more people to feel comfortable accessing services. And Magellan has seen that in our data, whether it's through more telehealth visits or just more visits in general to behavioral health providers. It's definitely a theme other companies have seen in the country. The second part of that is we've seen more new entrants into the system as well, saying that more people are finding the need for services and out there seeking to get them. In the work that we're doing with NeuroFlow and other organizations, we're looking at some of the risk factors for the development of higher levels of care. We're looking to intervene at the very beginning of a member's journey when they're first seen in primary care, or even before that as they look to have rising risk, and using digital tools as part of more comprehensive programs to really get those right services to individuals who show that need.
I think another part that I would add to that is, as Dr. Carney said, this pandemic really has unearthed what was a perfect storm. And a lot of times people feel comfortable starting those discussions and relationships that they have established trust, like with primary care physicians. Primary care physicians often need support to manage those kinds of conditions. And we've been working on important relationships that help support them in those journeys.
Yes, and for our audience who is unfamiliar, we've got quite a few sessions that are talking about integrated care, but more specifically, collaborative care has so much evidence around it, and it's exciting to see Magellan actually implementing this with some partners, just as you mentioned, Dr. Carney, NeuroFlow. Can we talk a little bit more about that? You know, what other exciting partnerships in the past year, details that you can share on that front?
Sure. So I can dive in a little bit deeper into NeuroFlow and then hand it off to Dr. Ball to talk about some of the initiatives she and her team have been spearheading. NeuroFlow is a technology company that helps us link data coming in from an individual to individuals who know what to do with those data and to make timely interventions. Through the use of an app that's connected to an interactive dashboard, we can push out assessments, push out tools for individuals, offer digital cognitive behavioral therapy to individuals, and really support them with the kinds of interventions that are needed to either help us understand when there's a greater need or to provide them supports along the way. We are all in on collaborative care with NeuroFlow and looking to implement that in our first set of clients within the next couple of months. Collaborative care, as you alluded to, is one of those evidence-based practices. And the NeuroFlow technology helps link the primary care or medical provider to the behavioral health provider and to a care manager, who really creates that triangle of communication between those different entities, where the psychiatrist better supports the primary care provider in getting the care right from the very beginning of the journey. And the tool supports us understanding what's going on with that patient as he or she is in the journey of treatment through their mental illness. I'd hand it to Dr. Ball to talk about some of the other, I think, really cool initiatives that we have been doing here at Magellan.
Thank you. So we've had a big year this year. My team's been working hard, and through a partnership that we're very excited about with Gallup, we've launched our Embrace product. And what that does is help members by starting out with an assessment to understand where they are on their journeys across a number of dimensions of well-being. So we look at everything from not just stigmatized behavioral health services, but how are people doing in their social lives, in their communities? How are things going in their career? what's going on for them physically, emotionally, and financially. So the emotional pillar was developed through the Magellan Gallup Wellbeing Project. And we believe that all 6 of these well-being dimensions are crucial to success and a well-lived life. We built this really very much on a human-centered design approach. So what we did was think about where people are on those dimensions and then served up services that are specifically tailored to help them on their journeys.
Thanks so much, Dr. Ball. Super interesting. And we'll be sure to share this information live throughout the chat, throughout this presentation, rather, and folks can learn more. Dr. Carney, I want to go back to you. When you look at the mental health industry today, what do you think is missing? And what do you think needs to start happening as a result?
That's a great question. I think the aspects that are missing from the mental health care are really foundational in 2 separate areas. The first is understanding what outcomes are for mental health care. And in order to get to the outcomes, I think we go back to something I said at the beginning of the conversation, which is aligning the right individual to the right kinds of services. So we should not expect someone with an acute psychotic episode to do well with an app and have a tremendous outcome. That individual will need the right level of treatment with the right kind of expected outcomes, like reduction in symptoms and return to community living with the best quality of life that they can have. For individuals, say, who have mild to moderate symptoms, who are in the workplace and active in their family life or active in their social life, we would expect the kinds of tools that they would benefit from to lead to outcomes like return to work, or again, that increased well-being that supports them in their roles as husband, wife, son, daughter, friend, worker, whatever that might be. So it's been very challenging across the industry to drive to what the outcomes are of that kind of everyday treatment for mental illness. We look at big markers like 7 and 30-day follow-ups from hospitalization. But that really only affects a very small number of individuals who are receiving services. The second area that I think is really important is looking holistically across the set of services. So for instance, in Medicaid programs, Medicaid has specific funding streams for the kinds of services that help us address social determinants of health, help build skills for individuals, help skills that individual has built be deployed in the real world, help with case management and navigation kinds of services, help with recovery support and peer supports. And often those kinds of services that are really critical for moderate to severe mental illness are missing in populations like those covered in the exchange or in commercial populations. So I think we really need to think about a full expansion of services across the continuum of care. It shouldn't matter who the payer is. It should matter that the right service is aligned to the individual who will benefit from that service.
I think that's important. And I wanted to talk about one population in specific that we have a partnership to address. And that's with a group called Duos. And that group offers personal assistance for aging and behavioral health support. This is an example of a high-touch program through a digital company that we've seen just fabulous results from. So this program is designed to connect older adults with companionship and care coordination and healthcare access while meeting their behavioral health needs and helping them live more independent lives. We had very good results with this program with a 88% net promoter score, where we met 97% of the social determinants of health needs like transportation, navigating through computers, help with social skills. And these are for people who are struggling with chronic conditions that often keep them housebound and sometimes can really foster isolation. So I wanted to point out that is one high-touch experience through a digital health company we've seen really good results from.
Thank you both so much. It sounds like you've got a number of solutions that you're really thinking about the end patient and what their exact needs are and meeting them where they are. Dr. Ball, you mentioned this high touch solution. I like to ask people, when it comes to tech versus touch, with so many new apps on the market, how do we know how much tech versus touch is the right balance for optimal mental well-being for the individuals you serve?
I think that's a great question, and we think about it a lot. Matter of fact, we have an esteemed board of scientific advisors on our studio advisory council. And so I think we use three principles when we think about evaluating this. First is, as Dr. Carney mentioned, is it evidence-based medicine? Second of all, does it enable us to serve a full continuum of care? So meet someone on their journey, whether they're struggling with more well-being sorts of issues or whether it's a more chronic sort of challenge. And then most importantly to us as well is how does that fit within a human-centered design approach? So we measure everything we do against those three principles. And we continue to map out a member journey, test and iterate on the solution. So for example, how do you balance something that's convenient versus something that someone will trust and use? We may have hypotheses about that, but unless we map out the member journey, see how they interface with whatever solution we're bringing to market and iterate on that, that really provides us with the answers. So I hope that's helpful as you think about this question, because I think it's an important one.
As a clinician who has dealt with individuals with very complex psychiatric and medical conditions at the same time, I initially was somewhat leery of the app world. And I think when I reflect on that, it's because a lot of it, at least at the beginning, came out as saying, this app is going to fix this condition. And, that's not the case. In many circumstances, it will actually really be the right thing to provide the care and access to an individual. But in those other cases, it's something that should be a supplement to the high touch care. And so I think if there's any model that drives us as a company, it's really looking at that combination of high tech, high touch, because we know that tech will work for some individuals as a standalone, but really support the journey of individuals with SMI in a way that enhances their overall experience and their overall ability to navigate the system and get services when they're needed.
I think that's a really important point, is that combination. So we've been talking a lot with our advisory council about this issue. And here's some important guidance that we've received is how do you maybe first introduce the app in person so people get to touch, feel, understand what the benefits are before they actually use the app. So that's something we've been thinking a lot about as well.
Thanks so much. So Dr. Carney, I'd like to ask you, I know that, of course, Magellan has been a leader in digital cognitive behavioral therapy tools. Can you talk a little bit about how they differ from traditional cognitive behavioral therapy?
Sure, absolutely. So we do have a rich history in using digital cognitive behavioral therapy through a program that was called Cobalt in the past. And we have been bringing that program into a more accessible format by building it into the NeuroFlow app. So individuals can have everything hang together in the same app and use it at the same time. Digital cognitive behavioral therapy, when it is built on true cognitive behavioral principles, is equivalent to face-to-face cognitive behavioral therapy for mild to moderate depression and anxiety. And so because the research tells us that these two formats of the same kind of therapy are equivalent. We feel comfortable in using it for the right patient at the right time in their journey. So for instance, it may be challenging for some of us to actually see a therapist during regular therapy workday hours. But with a digital cognitive behavioral tool, I could log on at 8 o'clock at night after dinner is over and dishes are done and work on some of those cognitive principles to help me, say, with an insomnia journey or depression or anxiety or other conditions that CBT will treat. It's really important to know as a consumer when an app says it uses cognitive principles or is based in cognitive theory versus if it is true digital cognitive behavioral therapy. Those are very different things. And our DCBT units are truly based on digital cognitive behavioral therapy. A lot of apps are informed by good cognitive principles like don't overgeneralize or don't catastrophize, but our tools take an individual through the same therapeutic journey they would in the office setting.
That's really good advice, especially for all of the innovators in the audience. Speaking of innovations, Dr. Ball, how can we ensure that all of these novel innovations and digital tools will be successful at implementation?
So from our perspective, we really do think first, second, and third about the member journey. So how do these innovations get to the member? How do they fit with the other treatment providers, perhaps, that are working with the member? How do they get these services through a payer? How do you know when someone needs that type of service? It's really thinking through the member journey and how they access these services in conjunction, perhaps, with other treating providers that we find to be the most critical. And as a point solution, you could have the best app in the world. It could have the best development and outcomes. But if it's not served up to a member when they need it in their journey and integrated with the rest of the care they're receiving, it won't be as helpful.
Thank you. That's so important. And given the resources that Magellan Health has today, it's clear that that you're able to do exactly what you're describing. Thank you both so much. I really appreciate your insights and feedback. Thank you for taking the time and sharing your expertise with us.
Thank you very much for having us.